Hello, in this webcast we're going to go through the contouring of a post-operative patient in a step-by-step process. The patient is a 55-year-old lady who approximately 1.5 years ago underwent a Whipple procedure for carcinoma of the pancreas. He was doing quite well, but approximately a year after the operation he developed asymptomatic lung metastases. About that time he also developed classical celiac pain, upper abdominal and lower back pain in a belt-like distribution. And he's been referred to us for treatment. So we're going to start off by looking at his CT simulation scan. Giving him intravenous and all contrast for the scan. Just looking very briefly at the scan, a quick overview. You can see here the liver, 2 kidneys, bowel. He's got some calcification of his aorta and other vessels. Now as we go back up, you can see here we can see his distal pancreas that was left behind. So here sees some various surgical clips. Artery, and a touchdown is the superior artery. Both here we can see here. Over here we can see the region of the clips, and next to the SMA we can see a tumor mass. And also a little high up on the celiac, we can also see over here, also seems to be some kind of, hard to say, but maybe some mass here abutting the celiac artery. So in my opinion, it's those masses which probably are responsible for his pain, and so in our planning, we'll both target the celiac plexus itself from D12 to L2, but also target those tumor masses. So let's go and first of all contour the normal structures. Okay, so now we're going to jump ahead after I've already contoured the 2 kidneys, the liver and the spine. We're going to move on to contouring the bowel. Now normally, as we discussed in the protocol, we normally recommend that the bowel be contoured in 2 steps. First of all is one very tightly defined structure, the distal esophagus, the stomach and the duodenum, and then as a second structure which can be done a little quicker as the more or aspects of the bowel which are a little further from the celiac plexus, and then the 2 structures are combined. In this particular example, because it's a post-operative Whipple, the anatomy is very different, and I decided to contour the bowel in one structure, and we're going to jump to the stage where I'm just looking for the reconstructed bile ducts. A little difficult. I think there's a small bowel here, so I'm actually just going to contour actually all the bowel in one go. Wasn't what I normally do, but in this particular case, I think that may be the best thing to do. Okay, I'm just going to kind of take all of this. I'm going to be too precise over there. Not exactly, for the small bowel, especially duodenum, I'm not going to be very precise in my contouring. I understand that's only going to move anyway, so I missed a bit out here. Okay, that's my next level, that's fine. Yeah, I think here we can start to see the wound loop, which was created during the Whipple procedure. That's just the pancreas there. Make sure we've got that all in. Yeah. Just gonna take all of this. Now I just understand what these structures here. There's a blood vessel, that's fine. Yeah, so okay, here we go. Okay, now we're going to interpolate. Interpolate is a little risky in these cases. Okay, now it's after we've interpolated, we're going to have to fix quite a few things up. See here, there's more bell there. Sometimes I use a 3D brush, just even as can help me just fix these things a little bit quicker. So it's just this is the old tribunal now. Oh. So it's very challenging in these cases to understand exactly what's going on. It's like, that's really down there as well. I contour all the reconstructed bile ducts. I don't think it was once bile, it was always bile in my opinion. Okay, so I think I'm fairly confident now that we've done that. Bowel, good. Okay, so now we've done the bowel. We're now going to go and do what we think is the tumor bed recurrence. I'm going to call this GTV tumor. And now, okay, you see there's a big goofy thing over here. Surrounding one of the blood vessels. Some of this is probably blood vessels, it's okay, we're just going to label all. Blood vessels can take 25 gray. Doesn't frighten me, we haven't seen problems with that. There we go. Just interpolate again. Okay, so we now identify the residual tumor and the bowel, and now we're going to do the celiac plexus. So the celiac plexus, we go from D12 to L2. So this is very simple. We're going to choose a brush, 0.5 centimeters diameter and static, 2-dimensional. We're going to click on, we're going to create a new structure called celiac. For some reason it's missing from my template. I'm going to call that a GTV. And here we're going to just go, first we're going to identify 5, 4, 3. So here at the bottom level of L2. And we're just going to go around the lateral and anterior aspects of the aorta. And we're not going to worry about any other anatomy at this point. Okay, we're just going to go like that. We're just going to go. I want to go from the bottom level O2 to the top of D12. So let's count again. 5, 4, 3, 2, 1. T12. So at this point I often just jump up to the top of T12 over here. I'm just going to mark that, and then we're going to work downwards, and we'll, until we pretty much cover this all. Okay, and I think that's it, and now we can interpret. And there we go. Generally at this point, we ask another physician to look at my bowel contouring and check that they agree with it. So now we're going to move to the 4D CT scan that we performed at the time of simulation with abdominal compression, and we're going to see how these structures move during respiration. Okay, so let's just switch on our tumor. Probably let's just go over here to the sagittal view. And we can see here got some surgical clips here. We can put a little grid on, set to 1 centimeter. You can see those surgical clips are moving about, I'd estimate about 8 millimeters, a bit more than most patients actually, I have to say, but it's less than a centimeter. Most patients are about half a centimeter. Let's just look again on this time on a coronal view. You can see it's moving from, yeah, again about 8 millimeters or so. Okay, good. Now let's go back to the 3D simulation film. Take off this grid view. Zoom up. Just again, I'm doing that. I do it in real life, and I just keep on looking at my bowel contours, just to make sure I haven't missed anything. Because we're about to expand it, and any mistake now will yeah, so here I can see that we missed a little bit here. Okay, so now we're going to expand the celiac. So we have a structure called expand celiac. Use this expansion tool from the celiac itself. We're going to do half a centimeter in all directions. And what's nice is on the eclipse you've got a void structure, and I don't want to go into any bowel. So half centimeter expansion, avoiding bowel, and that. Now we're going to take that residual tumor, and we saw that it moves about 8 millimeters. So I'm going to do, as I generally do, I'm going to do a 1 centimeter expansion on that. So we've got expand tumor here. We'll go to GTV tumor, I think was our thing, and we're going to add 1 centimeter. Okay, so the next step, so I'm going to add a 1 centimeter expansion to the tumor, and we're just going to avoid bowel. Okay, so now we have that tumor nicely gone to that, an expansion tumor, and now we move into expansions. The first expansion we're going to do is of expansion of the bowel. So expand bowel in all directions by half a centimeter. Okay, and now we're going to do the same thing for 1 centimeter. Okay, so we expanded the bowel, we expanded the GTV tumor, and we expanded the celiac plexus. We're now moving on to the dose painting part of the protocol. We're going to have 4 dose levels: 25 gray, 20 gray, 15 gray, and 10 gray. Within the protocol, there's some flexibility about what dose we give to tumor tissue itself, and I've decided in this case that I want to give a high dose to the tumor tissue. I'm going to give 20 gray. Now we're going to create this dose painting using Boolean operators, which are within the treatment planning systems. The PTV 25 gray is going to consist of those parts of the celiac plexus itself, not the expanded celiac plexus, but the celiac plexus itself, which are at least 1 centimeter away from the small bowel. So we're going to do that like this. Here we're going to take celiac, subtract, expand bowel 1 centimeter, and that's done. Now I'm going to move on to the PTV 20. This is a little bit more complicated because this time, as I mentioned earlier, that in this particular patient case I want to include also the residual tumor tissue. So I'm going to open the parentheses, I'm going to say give me, and then we're going to also include now the expanded celiac, or, and now we're going to have that structure that earlier we called expanded tumor. Okay. But from that combined structure, remove things which are either within 1 centimeter of the bowel, or structures that we've already given dose to in the PTV 25. Okay, so now we've created our PTV 20. Now we're going to jump to our PTV 10. We always do things in the order of 25, 20, 10, and then we go back and do 5. So the PTV 10 consists of, once again, that combined structure, the expanded tumor or the expanded celiac. But this time we're going to use the AND Boolean operator and those elements which are within 0.5 centimeter of the bowel. So that's given us that. And then we're going to go back. I'm going to say for PTV 15, let's take everything that hasn't got dose until now. So I'm going to expanded celiac, expanded tumor, and now we're going to subtract just all the other PTVs that we've got. Now there's one little catch here. We're going to use the Boolean operators, but at least on the Eclipse system, you can't have 3 terms within one set of parentheses, so we're going to have to parentheses within parentheses. You're going to see what I mean. Subtract PTV 25, or open parentheses PTV 20, or PTV 10, and close parentheses twice. You see that Eclipse is given that kind of an orange color. Don't be worried about that. It's okay. And then we're going to press OK. So now we've done the dose painting. Red is 25 gray, orange is 20 gray, yellow is 15, and blue is 10 gray. We can see here from the top to the bottom, here we've got the celiac plexus, we've got a cold shoulder because of the proximal stomach coming forward. We jump forward because of the residual tumor. Once again, we have a cold shoulder here because of the reconstructed bile ducts, which are made of bowel. Go down. Now we just have the celiac plexus. It's very good to look on a sagittal view. And once again, you can see here we have here the celiac plexus around the aorta and jutting forward here where the residual tumor is at the tumor bed. So now we finished the contouring and it's ready to give over to physics from dosimetry for treatment planning. Thank you.